Good day, students. Gastrointestinal diseases. We will talking about diseases of gastrointestinal tract, from esophagus, from the mouth to the anus. Gastrointestinal disorders is a term used to refer to any conditions or diseases that occurs within the gastrointestinal tract. The gastrointestinal tract is a series of hollow organs that form along continuous passages from our mouth to our anus. The organs that make up our gastrointestinal tract are mouth, esophagus, stomach, small intestine, large intestines, and anus. Abdominal belly pain in children is common condition and, while not generally and serious problems, one that can cause considerable discomfort. When a child who is otherwise healthy experience repeated stomach aches for more than 2 months or more, he is considered to have functional abdominal pain. Functional abdominal pain involves a severe sensitivity of the digestive organs in conjunction with changes in the digestive movement patterns. With no gastrointestinal damage. Some abdominal pain can be a sign of a more serious conditions, so monitoring your child is key in determining when to see a doctor. What's about classification? 2 board of categories. We see organic abdominal pain and functional abdominal pain. Here is localization of pain, localization or irradiation. For example, we can ask your patient about irradiation of liver or gallbladder pain to the neck, to the right side of the neck, for example. Organic abdominal pain is a true pain caused by damage to the child's gastrointestinal tract. As usually it is associated with weight loss, poor growth, unexplained fever, joint pains, swelling, mouth ulcers, and others. Organic abdominal pain could be due to celiac diseases, chronic disease, ulcerative colitis, gastritis, or infection. Please be careful with these symptoms. What's about functional abdominal pain? Is true pain interfering with a child's ability to function, but there is no evidence of damage to the gastrointestinal tract. Functional abdominal pain is usually associated with nausea, headache, sleep changes, dietary changes, changes with the quality of bowel movements, physical activity, emotional stresses, like as exam, for example, or test, or a class of pediatrics, for example. Sometimes our students are afraid us. It can be true, unfortunately. Common causes of abdominal pain in children. The first one is gas. sharp intermittent pains that travel around the abdomen. Constipation. Pain will present as a colon contract. Intestinal infection caused by a virus, bacteria, or parasites, and usually is accompanied by diarrhea, fever, or vomiting. Aerophagia. Swallowing air often from chewing gum or drinking carbonated drinks. Food poisoning caused by bacteria present in food is like an acute intestinal infection. Airborne or acid reflux. Pain occurs in the chest or just below the rib cage. Medication. Some medicines, such as aspirin or ibuprofen, can upset the stomach. I hope you know that nesteroid drugs can destroy the mucosal membrane of the stomach. And stress can cause an increase in stomach acid, which often result in abdominal pain. Food allergy or intolerance. Your child may be unable to digest lactose, sugar, have formula intolerance, or be allergic to the milk protein or some other food. So that means you should have a correct analysis about his diet. Colic, a common condition in newborns and infants in which a baby carries inconsolably from what seems to be abdominal pain, while not dangerous. Sensitivity to food in the mother's diet. In breastfeeding infants, abdominal pain can occur in the body if the baby is sensitive to something in mother's diet. Sore abdominal muscles. Stomach muscles can become sore after doing physical activity involving the abdomen, or if your child has had several vomiting episodes. Yes, of course, we should talking about menstrual cramps and strep throat or mononucleosis. What's about treating abdominal pain at home? Yes, of course, the first one, rest. You can take a warm bath or compresses to the stomach. Bowel movement. You can take to your patient anticides, is like as Mylanta, Maalox or Tums and others. Yes, of course, fluids, more than water. Avoid solid foods. What's about diagnostics? Diagnosis of abdominal pain involved in throat medical examination. What kind? When pain occurs? Doesn't pain occur near meal time? It's happened primarily at home or school, during the week, or on weekends. It's important for you for differential diagnostics. How long the pain has been occurring, and severity of pain, localization, type. What's happened? How many months you have tried, and how effectively if pain is allowed by eating or drinking or by hand to bowel movement and others. Once again, analysis. it's more important for you. What's about instrumental and laboratory tests? You can take X-ray to detect constipation, gallstones, kidney stones, tumors, or swallowed objects. Urinary test to check kidney function. The blood test to determine blood cell contents, to check, for example, for the Helicobacter pylori infection, or if you will take biochemical blood test, you can check a function of the liver and pancreas. Stool test, once again, to check for pancreatitis, blood and bacteria. Parasites, blood and bacteria. Yes, of course, you can taste for the ferments. You can see in the stool test what's happening in the liver, pancreas, stomach, and intestinal tract. Abdominal ultrasound and CT scan. What's about what kind of nosology you know? The first one, gastroesophageal reflux disease. What's happened? Gastric acid from the stomach moves upward into esophagus. It's happened as a result of a malfunction valve at the end of the esophagus. This lower esophagus sphincter muscle normally opens and closes to allow food into the stomach. If the muscle opens or relaxes longer or more often than it should, stomach acid refluxes into the esophagus. And this reflux can cause heartburn or vomiting. It can be, we see, throat pain, coughing, and chest congestion. In this picture you see when normal esophagus closes, and we see not normal. It's open and gastric acid up to the esophagus, and we see acid reflux. Symptoms of this gastroesophageal reflux disease: heartburn, vomiting, express burning, weight loss, poor appetite, bad breathing, choking sensation, dyspnea, croup, ear pain, and others. What's about diagnostics? pH probe and impedance testings, upper GI series barium swallow, and we should do X-ray picture, upper digestive intestinal endoscopy, and technical gastric emptying study. Treating: elevating the head of the child crab. What means when he's lying to sleep, he must, or his head must be elevated. Thickening the baby's milk or formula with rice cereal or thickening against. Holding the baby upright after feedings for 15 minutes. Introducing solid food. Eating small, more frequent meals instead of 3 largest meals per day. Remaining upright for the 2-3 hours after eating. Regular exercise. Avoiding foods that may aggravate symptoms, such as carbonated. Medication. Your doctor may prescribe a medication for your child or among it in our country's medicines. And in the hard hard cases, we can make antireflexes surgery, missing fundoplication. In these pictures you see what's happened, how we do it. Food allergies in children. Food allergies occur when the child's body reacts to a specific food as if it is a harmful substance. Their immune system sends antibodies to fight off the food allergen. What kind of signs? Mild symptoms include skin rash or hives, runny nose or congestion, tingling of the tongue, lips or throat, diarrhea, coughing or sneezing, abdominal pain in the upset stomach, nausea or vomiting. More serious symptoms are swelling of lips, tongue or throat, difficulty swallowing, wheezing, drop in blood pressure, chest pain, entering blood or loss consecutions. And severe allergic reaction is called anaphylaxis. It can be two. We should see it and to treat more than correct. What kind of cases can be? To the milk, eggs, soy, wheat, peanut, tree nuts, fish, shellfish, and others. What kind of testings for the food allergies? Skin prick test, blood tests, also called radiology sorbents test, food challenge, and food elimination diet. You can read it and write. Treatment. Antihistamines, oral steroids and topical steroids. And if you see wheezing of asthma or anaphylaxis, you should take in to your patient the correct emergency therapy. If in your country you have registered EpiPens, your patient can find it in his bag. EpiPen. Gastrointestinal disorders and food allergens. Symptoms of a food allergy can range from the extremely mild to life treatment. Allergic reaction can affect the gastric tract, more severe gastrointestinal symptoms, like difficulty swallowing, like as dysphagia, and sometimes it can be eosinophilic esophagitis. It's an inflammation disorder caused by the deposition of eosinophils to the wall of esophagus. People with eosinophilic esophagitis commonly have other allergic diseases such as asthma or eczema, but a personal or family history of allergic diseases may also be absent. Eosinophilic esophagitis can be diagnosed with upper gastrointestinal endoscopy. A treatment includes dietary changes and steroids that are recommended by the physicians on a case-by-case basis. The natural history of eosinophilic esophagitis is unknown, but on cases of cancer have been reported to date. Gastritis is inflammation in the lining of the stomach. It may occur a short episode or may be a long duration. What's about etiology? Helicobacter pylori. It's a bacteria which can reside stomach and destroy the mucous membrane. The genesis of acute erosive gastritis typically involves decreased foci of surface necrosis due to damage of mucosal defense. NSAIDs inhibit cyclooxygenase 1 or COX-1 and enzyme responsible for the biosynthesis of icosanoids in the stomach, which increased the possibility to predict ulcer forming. What's about chronic? Chronic gastritis refers to a wide range of problems of the gastric tissue. The immune system makes proteins and antibodies that fight infection in the body and maintain the hemostatic condition. In some disorders, the body targets the stomach as if it were foreign protein or pathogen. It makes antibodies against several damage and may even destroy the stomach or its lining. What does it mean metaplasia? Mucous glands metaplasia. The reversible replacement of differential cells occurs in the settings of severe damage of the gastric glands, which when gaze away and are progressively replace the mucous glands. Gastric ulcers may develop if they are the caused or the consequence. Intestinal metaplasia typically begins in response to chronic mucosal injury in the autumn and may extend it to the body. You see classification gastritis and duodenitis in international clinical diseases. What kind of signs and symptoms? Nausea, vomiting, bloating, early satiety, loss of appetite, and unexplained weight loss. It's one of them, but you should be sure to have correct analysis. Often a diagnosis can be made based on patient description of their symptoms, but laboratory and instrumental tests, blood tests, blood cell count for presence of Helicobacter pylori, antibodies to Helicobacter pylori, liver, kidney, gallbladder, or pancreas function you should test. Urinary releases, stool sample to look for blood in the stool, X-rays to increase the ulcers of the stomach and duodenum, endoscopy to check for the stomach lining inflammation and mucosal erosion and ulcers too, stomach biopsy to test for gastritis and other conditions, and once again to test for Helicobacter pylori too. What's about treatment? Anticides, HB blockers, and protein pump inhibitors, PPI. What's about peptic ulcer diseases? Peptic ulcer diseases is a break in the inner lining of the stomach. First part of the small intestine of the something is the lower esophagus. An ulcer in the stomach is known as a gastric ulcer, while in the first part of the intestines is known as duodenal ulcer. Ulcers in children can be classified as primary and secondary. Primary ulcers are more often associated with Helicobacter pylori. Secondary ulcers can be result from stress caused by the sepsis, shock, and intracranial lesions. What's about etiology? Helicobacter pylori what does it happen? Helicobacter pylori damage protective mucous layer and colonize and destroy it. And when mucous layer is destroyed, acid passes from the intestinal, from the stomach to the mucous layer and causing an ulcer. And it can destroy epithelial cells and it can destroy connective tissue and muscle tissue too. NSAIDs, non-steroidal anti-inflammation drugs, and aspirin can increase the risk of getting peptic ulcer too. Because they are destroyed mucous membrane, and once again acid destroy the mucous and other cells. Stress and diet. You will read this information and write. What's about pathogenesis? The genital epigastric disease may be considered as a combination scenario involving an imbalance between defensive factors and aggravation factors. Play an important NSAIDs play an important role in this pathogenesis. Againstly are Helicobacter pylori too. Here you see information about what's happening with Helicobacter pylori, how is it in fact localization in the stomach, and the response in the gastric mucosa with introductions in something cytokines and interleukins 8, 1b and others, and how it destroys cells of the stomach. What's happened? You should write it and on the to tell me in the class. Metaplasia is a central prescurrence for the Helicobacter colonization of duodenal epithelium because colonization is specific and exclusive to gastric epithelium cells. After colonization of islands of duodenal gastric metaplasia, the inflamed duodenal mucosa becomes more susceptible to peptic acid attack and ulceration. Localization. The classification by localization: duodenum, esophagus, stomach, mecal diverticulum, but it was modified by Dr. Johnson. Type 1, ulcer along the body of the stomach, most often along the less curve at incisura angularis locus minors resistance, and not associated with acid liver secretion. Second type, ulcer in the body in combination with duodenal ulcers, associated with ulcer acid liver secretion. Third type, in the pyloric channel within 3 cm of pyloric associated with acid or secretion. Type 4, proximal gastroesophageal ulcer. And type 5 can occur throughout the stomach, associated with the chronic use of NSAIDs. Signs and symptoms: abdominal pain, classically epigastric, strongly colorated to meal times. Bloating and abdominal fullness. Water brush, Neisseria copious vomiting, loss of appetite and weight loss, hematemesis, melena. Rarely an ulcer can lead to a gastric and duodenal perforation. Complication: gastrointestinal bleeding, perforation, penetration, gastric outlet obstruction, and cancer. Diagnosis: stomach pain, localization characteristic, changes in the endoscopy, and confirmation of the diagnostics in the X-ray tests and endoscopy. In endoscopy, you will see a form of this gastritis or ulcer. reasons of one of the reasons to the blood tests are not reliable for accurate peptic ulcer diagnostics. On their own is their inability to differentiate between past exposure to the bacteria and current infection. Helicobacter pylori can be made by urea breath test, direct culture from the endoscopy biopsies. The next one, direct detection of urease activity in the biopsy specimen by rapid urinary test, measurement of antibodies levels in the blood, stool antigens test, and histological examination and staining of the endoscopy biopsy. What's about treatment? If he has anemia, should correct anemia. If it has, once again, is like as for gastritis, anticide, PPI, so, and H2 receptors antagonists. Ulcer therapy has two goals. You see this, yeah? Ulcer heading illumination for the primary cause. The first line, drugs, is treatment PPIs and H2 receptor antagonists. And sometimes, if your tests to the Helicobacter pylori are positive, you should take to your patient antibiotics in combination with PPI. Surgical therapy. It can be too in if you see complications. Pancreatitis is a condition characterized by inflammation of the pancreas. The pancreas is a large organ begins with the stomach that produced digestive enzymes and a number of hormones. We can see acute pancreatitis and chronic pancreatitis. What about etiology? Caused by alcohol or gallstones. What's about indication? There are seven classes of medications associated with acute pancreatitis: statins, ACE inhibitors, oral contraceptives, and others. What's about infection? Yes, of course, viruses, bacteria, fungi, and parasites. Pathogenesis. After an initial insult, such as the ductal disruption or obstruction, there is premature activation of trypsinogen to trypsin within the acinal cells. Trypsin then activate their pancreas proenzymes, leading to outer dejection, further enzymes activation, and release of active protease. Lysosomal hydrolysis collides with pancreatic proenzymes within the annular cells. Pancreastasis with continuous synthesis of enzymes occurs. Pectin is activated by phospholipase A2 into the toxis lysolecithin. Criteria of diagnostics. Behind S2 to 3 of the following: abdominal pain, serum amylase and or lipase activity at the last 3 times greater than the upper limit normal, and imaging fungus findings, characteristics or compatible with acute pancreatitis. Clinical manifestation: with mild acute pancreatitis, the patient has a severe abdominal pain. He has persistent vomiting and possibility it can be fever. The pain is epigastric or in either upper quadrant. Staging of them result in the child asymmetry, assigning an Atlantic position with the hips and knees flexed, sitting upright or lying on the side. The child is very uncomfortable and irritable and appears acutely ill. The prognosis for a complete recovery is acute uncomplicated case is excellent. What's about severe acute pancreatitis? Severe nausea, vomiting, and abdominal pain. Sometimes it can be shock, high fever, jaundice, acute, and hypocalcemia. Serum lipase is now considered the test of choice for acute pancreatitis, as it is more specific than analysis for acute inflammatory pancreatic disease, and should be determined when pancreatitis is suspected. The serum lipase rises by 4-8 hours, peaks at 24-48 hours, and remains elevated 8 for 14 days, longer than serum enzyme. You can make X-ray of the chest and abdominal line to demonstrate non-specific findings, unfortunately. But you can see the changes of the biliary system if you see biliary stone. CT scanning has a major role in the diagnostics and follow-up the children with pancreatitis. Findings can include pancreatic enlargement and hypoechonic edematosis pancreas, pancreatic measles, fluid collection, and others. Endoscopic ultrasound and ultrasonography also helps visualize pancreatic system. What's about treatment? analgesia, fluid, electrolytes, mineral balance. This, of course, it's important for your patient. Endoscopic treatment is your serious bile stones. Chronic pancreatitis in children is often caused by genetic mutation or by congenital anomalies of the pancreas or ductal system. You correctly read and write information about etiological factors like as mutation in the genus of the which code normal situation with bile tract. Also about autoimmune pancreatitis, you should read about his clinical about jaundice, abdominal pain and weight loss. You see this clinical picture of the all, but you see that immunoglobulin G4 will be increased, and we see the changes for the blood tests. Biliary dyskinesia is a disorder of some component of biliary part of the digestive system, in which bile physically cannot move normally in the proper direction from the tubular biliary tract. It most commonly involves abnormal biliary tract persistences, muscular coordination within the gallbladder, and response to the dietary stimulation of the organ to squirt the liquid bile through the common bile duct into the duodenum. Inactive peristaltic contraction of the structure products postprandial. And almost no more problem. Also about mechanism, we see normally the downstream of gallbladder stones and concentration within which organs in the liver, hepatocyte cells, and the result into the microscopic component by the Berger's system in the liver. Proof and aggregation tubulus of increasing diameter, the bile levers of the liver and reaches of the upstream component of the common bile duct. Apparently, the common bile duct beyond distal to the gallbladder tends normally have a great tone, so that the bile back upstream into the gallbladder. And we see the changes of passage of a passage of a bile. So that means biliary dyskinesia is a dynamically obstructive, pain-producing disorder. Obstruction by a stone or tumor isn't static. Mechanical obstruction intends to produce more intense pain, known as a biliary colic. Failure of the biliary sphincter of Oddi can be distinctly cured from failure of the pancreatic sphincter. Diagnosis may not be determined by an ultrasound, but most likely of the disease or outbearing the disease of the liver, gallbladder, and bile duct, and others. The treatment. Laparoscopic cholecystectomy has been used to treat the condition when due to dyskinesia of the gallbladder. Symptomatics may persist after cholecystectomy and have been linked to the use of proton pump inhibitors. Osteopathic treatment, oral magnesium supplementation with 325 milligrams, and the use of digestive enzymes caused improvement of the case. The next illness is inflammatory bowel disease in the children. It's a condition which causes chronic inflammation of the intestines for reasons that they are not yet clearly understood. The child's immune system becomes abnormally active against his or her own intestines. Researchers aren't sure of what cases with, but IBD seems to occur as a result of genetic and environmental factors. IBD comes into two forms: Crohn's disease and ulcerative colitis, UC. What's about Crohn's affects the deeper lower layers of the small and large intestinal, can be involved in any part of the digestive system, but you see ulcerative colitis, that means colitis just in the colon. If you see chronic disease in the all part of the digestive tract, ulcerative colitis just in the colon. What kind of symptoms? The most common symptoms include diarrhea, often with blood and mucus, abdominal pain, low appetite, weight loss, unexplained fever, fatigue, growth, and pubertal delay. You see these changes of inflammation in the normal. We have to see inflammation in the Crohn's disease. You see inflammation, mucous hypertrophy, cobblestones appearance, fissuras, and we see fat wrappings. And if we're talking about ulcerative colitis, we see ulceration within mucosa. It's a lever of destroy. Please remember this. Diagnosis: chronic disease. Diagnosis by finding specific changes to the intestines. To see these changes, we can in the stomach, esophagus, small intestine, in the large intestine, and we can see it's just by endoscopy. Also about chronic disease, inflammatory bowel disease that involves in the end of the small intestine in the ileum and the beginnings of the large intestine colon. Crohn's may also involve any parts of the bowel system from the mouth and to the end of the rectum in others. Ulcerative colitis, once again I repeat this, yeah? Sorry. Oh, what is it? What's known about symptoms of a chronic disease? Chronic diarrhea, abdominal tenderness and pain, loss appetite, weight loss, unexplained fever, arthritis, anemia. They can have another symptoms. And causes. Exact causes of Crohn's diseases are not completely known, but we can see that something factors. A child's risk of having Crohn's is about 10th grade if they have related with the disease. It is believed that child with the Crohn's, the intestines are mistaken for the antigens or invading substance in the body. As a result, the immune system calls inflammation to combat the antigens. Inflammation can also be triggered by microorganisms and bacteria in the intestines. Research has revealed and Crohn's is more common in urban than the rural areas and more common in northern climates than certain climates. What's known about treatment? Antibiotics, anti-inflammatories, antidiarrheal, immunosuppressor drugs, and supplements for nutrition definition. What's known about ulcerative colitis? It's in the colon, yeah? What's known about clinical picture? Frequent diarrhea, often with a pass of the blood or blood, abdominal cramping and pain, urgent need to have a bowel movement, rectal pain and bleeding, fever, unexplained fatigue, loss of appetite, weight loss, anemia or low iron fever, eye, joint or skin irritation, growth or developmental daily. What's about diagnostics? Anamnesis. You should understand what's happened with your patient. You should know what kind of stresses he has, what kind of medications your child takes, and others. Diagnostics: blood test, stool test, X-ray, upper endoscopy, lower endoscopy like as colonoscopy, and CT scan. What's in about something changes. Ulcerative proctitis. distal colitis, left-sided, Proctus stigmoiditis, and pancolitis. You can see these changes with the colon. Treatment: controlling of inflammation, relieving symptoms, correcting this in nutrition. Yes, of course, anti-inflammation drugs to treat this inflammation, immunomodulators, antibiotics, and biological treatment to treat involves using antibiotics to interfere with the disease inflammatory process. Thank you for your attention.